Done?
Tom, take it away.
Hello, everyone, and welcome to another edition of Hopkinton Hangout. This is our second show, and this is what we will be doing for the foreseeable future while we have the coronavirus pandemic upon us. We are joined today by Hopkinton Health Director Shaun McAuliffe and Public Health Nurse Kasey Mauro. I'm Tom Nappy, HCAM News Director. Shaun and Kasey, welcome to the show, and thanks so much for joining us. Shaun and Kasey, can you hear me?
Oh, yeah. Can you hear us?
All right, there we go. Thank you so much for joining us today.
All right. Thank you for having us.
All right, so first off, can you both just introduce yourselves and tell us what your job is in town and what your role has been handling the coronavirus outbreak?
So I'm the health director, and my primary position in this is to help set policy and procedures for our response. So I work directly with Chief Slayman in setting up our core management of any issues, and again working with Norman and Elaine to help set policies that will be put into place at Town Hall.
And I'm Kasey Mauro. I'm the public health nurse in town. Typically, a public health nurse is usually in charge of doing disease surveillance, some education, and so I play a big role right now in the outbreak because there's so much to learn about COVID. It's constantly changing. This is new for everybody, including physicians and hospitals. So, just getting people and having to manage their whole entire case, basically from the time they start to have symptoms all the way up and just getting testing and then quarantining and having to help them get through that whole process. And then also doing education for the general population about public health measures that we're trying to implement and trying to just get people to really follow just to protect themselves during this time.
All right, thank you very much. So can you talk about the coronavirus situation in Hopkinton? How many cases has there been, and how many cases are there currently? And I also understand you have some people under observation.
Yeah, so current cases in town right now, so current positive cases, our total count is 7. Our current caseload right now is 6. We have recovered 1 person, so that's great. Great news. And then we have 32 people that are under quarantine, and those can be people that have symptoms of coronavirus or don't have symptoms. Maybe they had contact. It doesn't mean that they're all going to test positive. We only have 2 out of that 32 that are actually pending results.
Hi, real quick. I'm here just to monitor the social media, but if whoever's talking, can you just move closer so the audio is a little bit better, please? Thank you.
We're trying to maintain social distancing, so maybe we'll take turns.
Yeah, of course. Just one at a time. Whoever his turn is talking, that'd be great. Thank you.
Okay.
And I do want to mention that Matt is with us, and we are taking questions on social media via our Facebook page and YouTube page. If you have questions for the Hopkinton Public Health Director, Shaun McAuliffe, or the public health nurse, Kasey Mauro. So there was a team put together to address the COVID-19 pandemic in town. Can you talk about who is on that team and what their responsibilities are?
Well, as soon as we realized that it was prudent to close the schools, we engaged the superintendent and brought on the school nurses to assist us with contact tracing, and just basically bring in the manpower that we were going to need to make the several hundred calls to trace contacts with people that were known to either be positive or whose loved ones in the home were potentially out and about and exposed. And then once we started that team and we engaged in that process, we met with Chief Slayman and in Norman, and we started to engage the emergency management group, and we set up a command center. We meet several times a week, just discussing our different roles, setting up, we established the communication role. We started putting together a process to get updates out. And then the whole time we've been meeting with the town leadership to bring them up to speed and address issues that they might be encountering with the day-to-day operation of their offices, and we've been drafting policies and procedures to assist with risk mitigation in the town hall. So it's, but we got at it early, and I think we've put together a really strong team.
Absolutely. You guys have done a terrific job. Now, the last couple of days, I realized in the press releases that you're sending pretty much every weekday that the number of coronavirus cases has slightly increased in Hopkinton. Can you talk about why that may be?
So I'll get closer to the screen because I know it's me that's the quiet talker. So, I mean, there's really no scientific reason for why there's one person a day. When we send someone to get test results, it's taking anywhere between, I've seen test results come back in 24 hours, and I've seen test results come back in 7 days. So it really just depends on kind of like their severity of their caseload. So if they have somebody that is, that needs more, that's in the hospital, needs more care, they're going to choose that sample over somebody that's at home recovering with minimal symptoms. So that's why some can take even longer. But the testing has become easier to get people tested. It's still taking quite a bit to get the results, but it is much easier to actually obtain a test. There are some drive-through sites, and it's just the whole process has gotten much better.
And how has the participation been in town from those who have tested positive for the virus or in quarantine or under observation?
In general, they've been highly cooperative. At the end of the day, I'd say all of the residents understand the issue, and we haven't had any issues with them following our orders. We haven't had to take any administrative action, and so from a local standpoint, we've had no problems at all.
So how did you discover these cases in town? Was it that they reported it to you, or did a hospital report it to you? Could you just talk about the process a little more?
So there are several ways that a case can come up, and so typically what is supposed to happen is that the DPH has a website. It's called Maven, and so that's where the cases would get uploaded once somebody was positive, and that's kind of how you get your first clue, and then you would follow back and do a trace back for anything else. Because this is so new, and because there was such limitations in testing, they had gone to a model that you could either test positive for coronavirus or you could be clinically diagnosed as having coronavirus. And so we've had to follow up with physicians and just make sure that if they're not seeing patients and they are clinically diagnosing people, that they need to just follow up with us and make sure that we know these people are in quarantine, so we can help them through that process, because there is so much new language out, social distancing, isolation, quarantining. So just making sure that people understand exactly what they're supposed to be doing and then what their family members are allowed to do is important, because there can be a mistake. There's just too much coming out right now, and their emotions are already so high. It's really hard to process that much information, especially if you just got told you have coronavirus and you think it's going to be this awful thing. It's a lot to take in. So, we've gotten from all over the place. We search, we follow up even with negative, just to make sure that, that they don't have any symptoms, that they know how to take care of themselves and their family, and like how to proceed for every scenario.
All right. And what are some of the things that are I'm sorry, Shaun, did you want to add to that?
No, I was just saying that, I mean, we've been tenacious. I mean,
I think we've been given some, but we've looked for most of them. I think that it's just coming at you so fast that nobody can
Right.
really do their job 100%. But I think that because we were a little bit proactive, we were able now, instead of just managing what's being given to us, we're also looking for more.
And I think it's put us in maybe a stronger position than some of the other municipalities in the region, because we're actively looking for these cases. Because at the end of the day, that's what we're here for, is to identify them and mitigate the risk to the residents of Hopkinton.
And I believe you guys are at Hopkinton Town Hall right now.
No.
Oh, no, you're not. I'm sorry. What are some of the things being done with the town staff that still has to work as part of the social distancing? Because the town has to keep running. So what are some of the things being done with the town staff that still does have to work?
So, one of the first things was we had to identify, what our risks were in town hall, whether or not we were comfortable in putting into play or just executing on the plans we had drafted initially. And then we went back and said, there were issues with the execution of some of the initial plans, and it was just going to be safer for the residents and the employees of town hall to close town hall. And then within town hall, we're setting up, procedures for taking in mail, taking in, plans, for holding meetings. So we've gone to, to Zoom. So, meetings are in digital format. We've restricted non-essential people. We've asked non-essential employees to work from home. High-risk populations within that are a subset of our municipal employees, we've asked to work from home to just limit their potential exposure. And then we continue to reevaluate the policies and procedures we have in place to make sure that, again, we're being as protective as we can to the municipal employees and those residents. And then I think you can speak to some of the enhanced policies and procedures we put in place with the fire department and the police department.
Oh yeah, one thing we have done, we're a small town, so we need to take care of each other. Like our health department is only 4 people, and so like the police and the fire department are also small departments, and knowing how difficult it can be to get some clear answers about COVID. The fire department and the police department will, if like anyone has any questions or has any symptoms, they reach out to me, and I kind of am performing like an occupational health service where I help screen those people out and then help get them to testing if that was necessary. But just making sure that we're working together as teams just to protect everybody, because we're trying to maintain the functionality of our town with our little tiny, a group. We're not a big town. We don't have a big fire department. We don't have a big police department. So just trying to maintain functionality and just keep each other safe.
And I was going to say, every department in town has been provided an employee decision tree.
Yeah.
So each day, depending on the activity in your department, you're to run through the decision tree with your employees, and it's really just a balance process.
Yeah, it's just a double check, to make sure that that nobody's coming in with potentially like bringing in something, and we're not going to be exposing anybody to anything else. We're just making sure there's those double checks to make sure that we are keeping everybody healthy and reducing our risk as much as possible.
And I think we've all identified that and acknowledge that, we're all being held accountable to
Yeah.
protect each other. So,
Yeah.
You live and die by your survey. And if we're all abiding and if we're all complying, we should have a much better outcome at the end of the day.
And I just want to reiterate, we are taking questions on our YouTube live stream as well as our Facebook page. So if you have a question for the Hopkinton Public Health Director, Shaun McAuliffe, or the Hopkinton Public Nurse, Kasey Mauro, feel free to reach out via our Facebook page or YouTube stream. And we did have a couple submitted questions. What have you been doing, if anything, to make sure that businesses are complying with this? And have you had any problems with businesses?
We haven't had any problems with businesses. We have had a number of businesses contact us for clarification on the governor's orders. But again, I believe everybody has identified or is taking this seriously, and they don't want to be responsible for a larger outbreak. So we've had good compliance, and again, we continue to reevaluate our policies and procedures in different establishments. We kind of work remotely from the main office. So our main office is there. I have them polling different permitted establishments on what their policies and procedures are, how they're maintaining social distancing for takeout or within the retail area. And then I'm slowly getting out to verify that those processes are in place. That being said, the last thing that either of us want to do is to be circulating, in public more than we have to.
Right. Very true. Are there any policies in place for the restaurants still doing takeout as far as the town's concerned? I know there's state policies, but has the town implemented anything further?
There are other towns that have taken some action. Like other towns have not allowed people even inside the restaurant to do takeout, and so that's been up in the air. We haven't decided on that officially. I do think that it is a risk. Having everyone open the door, all touching the same door, even if people are maintaining that 6-foot distance, there's the potential that somebody just coughed into their hand and then it's going to touch that door, and now you're going to touch that door, and you might be so hungry you're going to take your food and eat it in your car. That you have like a big potential there for an oops. So we'll think about it, but we haven't done it yet. But it is something we have pondered, just haven't felt like we need to do it just yet. And then I know some businesses in town, like even before the governor had the advisory, had decided to close things down just for their own safety. So I feel like we've had really good cooperation with everyone. I don't think we've had any issues with businesses. Everybody's trying to keep each other safe and do the best they can.
And these risks that Kasey described, it can all be mitigated simply by washing your hands, and that's why we continue to reinforce hand washing, social distancing, staying home if you're sick, and if we're all doing that together, a lot better off.
Yeah.
We have a couple questions. We have
sorry.
a couple questions. It's okay. We have a couple questions coming in from our YouTube feed. Do we need to quarantine things arriving from outside of our homes, like deliveries or food purchases or anything like that?
Go ahead.
Okay. So this came up in the last couple of days at town hall. So what we did is I took a look at all of the NIH data that's been processed over the last week. We were in touch with the Postal Service, and right now their research hasn't identified any risk and any known cases across the world associated with the transmission of mail and contact with mail or packages. That said, there was a NIH study done about 2 weeks ago that said cardboard could potentially hold virus for up to 24 hours, but at that 24-hour period, it was so decayed that it wouldn't be able to transmit or cause an illness. So you have two things. You could put your mail aside for a day and just put the mail in quarantine, or you could open it, remove the letters from the inside, discard the external packaging, and then just make sure you wash your hands.
Of course. And one more question, and we can get back to Tom. Say my family goes out for a walk. We don't need to practice social distancing from each other, right? Because we all live in the same house. We all share the same space anyways. That's not necessary, correct?
Yeah. So you could go out for a walk, a hike, whatever with your family. Anybody that's within your immediate home, and that's fine. It's just that if you're going for a walk and a hike with 500 other people, it's those other people that you need to stay 6 feet away from.
And what are the steps a person should take if they feel they may have coronavirus? Should they call you guys? Should they call 911?
So if you look on the CDC website and the TPH website, they will tell you that the main 3 symptoms of coronavirus are cough, fever, and shortness of breath. And so if somebody was experiencing those 3 symptoms and it was severe, they should call 911 and tell them their symptoms so that they can don the proper PPE so they're not exposed, and then they would need to go to like an emergency room if they're having severe shortness of breath. If somebody knew that they had contact with another positive case, they can either contact their primary care to have them place an order for a test. That can be a little bit challenging. A lot of primary care offices aren't equipped either with the PPE or the actual test to perform them. So if somebody were to run into an issue, we're available. I'm on my phone 7 days a week. I am available all the time, and I feel like I haven't gotten off the phone. I've been talking everyone through it. But we do have this extra resource of us being here, and we've already gone through it. And we're well versed now. So if somebody was concerned about having coronavirus because they knew they had an exposure, that's a little bit easier to go through the system than versus somebody who says, I have a cough today. Like, I think I have coronavirus. Like, that person might need a little bit more help to dig and figure out, like, were they in like a taxi cab, and did they not wash their hands, and did they share something with somebody else? Have they not been social distancing? Like, it just requires some more digging to try and figure out a little bit more information. But basically, once you have the symptoms, you would just go get tested, and then you need to quarantine and isolate from your family if you're within the same home, and then wait for test results.
And someone just asked, if you think you have the 3 main symptoms, should they call 911?
No, so if you just had fever, cough, and shortness of breath, you shouldn't call 911 for that. You could go to an emergency room if it was severe. If you just have fever, cough, and shortness of breath, but it doesn't feel severe, like you don't feel like you're in respiratory distress, you could just call your primary care or call us, and we can help you get through the system. But it's just if somebody had some warning signs, like say if they started to feel very dizzy, or like they couldn't catch their breath, or if the loved one saw that their lips were blue, or if they became like disoriented, that's a sign of like somebody not getting enough oxygen. So just being able to recognize those signs and know that that's a 911 versus like just having a regular cough. Like, that's not a 911 emergency. You don't need to call 911 for that. You don't need to go to the ER for that. We can handle it through your primary care or one of the urgent care drive-through test sites.
Excellent. And we had another submitted question. What are you guys doing to protect your families?
This.
Yeah.
I live here.
We're there.
No, I live in Hopkinton, so I feel like we're doing everything that any parent would do. That I'm trying to protect everyone in town and protect my family in the same sense by making the most cautious decisions we can and pushing Shaun to do the same. And we're here alone. We're not with anyone else right now, so he's technically part of my immediate family.
Right.
And we still this is the closest we get to each other, but we maintain that part when we're working and communicate. We have like a tickle in our throat or anything. We would certainly tell each other before we came into work, and I constantly am getting hand sanitizer, and he's like, "Did you wash your hands?" And so just keeping each other in check.
And it's just practicing what we're preaching at home. It's, tonight I'm going to make a run.
And Shaun, I'm sorry to interrupt. If you could just take a step forward.
Yeah. So like tonight, I've got to make a grocery run. I have a 4-year-old's request for ice cream. So it's taking precautions when do I actually need to handle a shopping cart? Can I get in and out with just holding the item? And then when I get into my car, I have a whole routine now where I do a quick wipe of my doorknob, I open my door, I have wipes in my car. As soon as I get home, I wash my hands. So I'm taking all the steps that I can to reduce my risk before I get home. And then the first thing I do is wash my hands and then engage, my kids and my wife. So it's just practicing, good hygiene. So that's probably the biggest thing that we're focused on.
Right.
One of us wants to do this alone.
We have a few more questions coming in from YouTube. Do the Hopkinton EMTs have all the PPE and everything that they need to deal with COVID-19 patients?
Yeah, I think every person right now that's in charge of taking care of COVID patients wishes they had a little bit more, but they have enough for right now. We have actually been contacted by the high school. They use the 3D printer to make face masks. So that's like super cool. I think yesterday, I want to say they put 13 of them together. And we're hoping to drop them off to the fire department on Friday. So it's really exciting to see that our community, even though the kids aren't in school, because kids are actually working on the project too, work together to make sure that we have these supplies, because it is difficult to obtain them because everybody wants them right now. But we do have enough for right now.
The important thing that we can do is that if you're calling upon public safety for assistance and you think you may have been exposed, we want you to communicate that to public safety so that they can prepare before they have contact with you at home. That's really the critical step that needs to be completed to protect our public safety officers.
Awesome. And are both Milford and Framingham hospitals accepting COVID-19 patients who are experiencing these extreme symptoms?
I think so. I think they're both. I think I don't think any hospital can say, "Oh no, you're COVID." No, they're taking. They're taking them, and each hospital has their own protocol for how they deal with the patient. But no, I don't think you're allowed to say that you wouldn't take that patient. Plus, the majority of the time, you don't know you're taking a COVID patient until you found out 2 days later after you've tested them. So I think that different hospitals have availability to medications that they're trying to use to treat people, but not all hospitals have it. And I don't know which ones have it or not. I just know that some hospitals don't have medications that they're trying out right now.
All right. And another question that is being asked, with the ban on the reusable bags, will Hopkinton lift the ban on single-use plastic bags?
Yeah.
So that ban will be lifted until, and that's per the governor's, I guess it's the governor's order.
Mhm.
But so that'll be lifted until we're out of this. There's no specific date provided. And then once we are clear, we'll go back. Because one of the things that people, one of the main reasons we went about the bag ban was actually to support Harvey. The more we do to support a reduction in their offline waste management, the lower the costs are, and then it ends up being a reduction in fees for service here in Hopkinton. So yeah, that's kind of getting away from coronavirus, which is actually kind of nice.
As far as reopening businesses, obviously state legislation lays out the guidelines, but does the town have a say at all within those guidelines as far as when a business can reopen? Can the town step in and say, no, we're not ready to let you guys open yet?
We always have the right to be more restrictive. And certainly if we felt that we had an issue in town that warranted being more restrictive, we would act upon that. And we have both the governors and the Department of Public Health's support in that. And that's, one of the, like 2 weeks ago, they weren't recommending that any schools be closed. But given our individual situation, we felt it was prudent.
Yeah,
And
not just ours, it was the whole
Right.
Middlesex County issue. In fact, they dropped, I think, 47 cases into the Middlesex County. And so at that point, all you know is that it's near you. You don't know exactly where it is. So given like our own unknown risk, plus all of the other ones, we just wanted to put a pause on it and make some good decisions, not send the kids to school for one day, have it close in the middle of the day, reopen the next. And so we just closed it down to make the best decisions and do a full risk assessment and get ahead of it before, we made a mistake and would have potentially sent kids to school and then, done things like other towns did.
All right. And again, for those of you just joining us, we are with Hopkinton Public Health Director Shaun McAuliffe and Hopkinton Public Health Nurse Kasey Mauro. If you have any questions, we are accepting questions on our Facebook page as well as our YouTube stream. And could you both talk a bit how you are both doing? I understand, I'm sure that you've been working a whole lot of hours with this coronavirus pandemic.
I don't ever fill out my timesheet beyond Wednesday. Wednesday morning is typically the cutoff because I've got, my 40 hours in by then. This is, I think we're both doers. We're both in this to protect the public. So we invest as much time as we feel is necessary.
Yeah, which is a lot.
Yeah. Yeah. If you ask the superintendent.
We're getting through it. We're
Yeah.
getting through it. No, I mean, I honestly feel like we, as a department, the two of us feel like we're probably where most towns are. Like most towns are where we were last week. I think we've moved through all the different phases, and we're now in the acceptance phase of like this is going to be life for a while, and adjusting our work and everything that we do to that this is life, and we're just going to need to be able to operate like this for a while.
And we have good relationships with the DPH and other agencies, and one of realizing that they're as busy, if not more. We realize I do a lot of my email exchanges with the state at 9 to 11 o'clock at night. But that's when we're corresponding. And then I can pass that information on, and my chair or Norman will tell me to go to bed.
Yeah.
But that's what it takes to stay on top of this.
Absolutely. It's certainly not an easy task you guys have at hand here.
No, that's our job right now.
Oh yeah, I did ask because in the emergency management group, you're supposed to designate somebody as your secondary. And so I had asked a few nurses that I knew, and I got a no thank you. So if there's any nurses out there that want to be me, if something were to happen, I guess now is a good time to ask. It's not so bad.
No.
Do you know if there's any plans for testing sites in town?
No, we don't have unfortunately, we don't have like the ability to do testing. Like we don't have a lab in
Oh.
town like that we could.
They're
Yeah.
analyzing in town, but they're not.
Yeah,
testing.
but I mean, we wouldn't have like a drive-through. First of all, this program started in November, and I just had an office like with a computer, so I didn't need to order any supplies. So because I didn't order any supplies this year, and because this coronavirus happened so quickly and everyone needs PPE, now I can't order any supplies because I would be a new account and no one's accepting new accounts. So I can't really order anything anyway to do anything. So.
And then to that point, we're not willing to start an operation where we can't assure the public health and safety of all of the people that are involved. So, we're happy to have a corporate partner who's they're analyzing a lot of the samples right now, and I don't know that we want to go beyond that.
No, I hope we don't get there. I don't really want to do that, and I don't think we're supposed to do it.
Do you know about all the test results in town? If somebody's tested in town, do you get that result, or are you part of the testing? And if so, do you know how many tests per day are taking place in the local area?
That's a tough question, because so one of the things that's happening is they're constantly bringing in new labs now, and each one of those labs has to configure their data dump to the state, and then because this is all moving in real time, we had data that we were waiting for a week, and then it was hammering people like, why don't I have this analysis? And then them realizing, oh, it's because the two systems aren't communicating properly and the data was all getting backlogged. And so they're constantly addressing this, and not all of that data that is produced for Hopkinton residents is getting pushed down to us. So again, we have to go, we go now on a daily basis, we go in looking for data that hasn't been pushed down to us.
I think the total number of cases total number of people that were tested, including like health get into testing that would be positive for testing, that would be negative for testing, that maybe got tested at their hospital because they're a nurse and not symptomatic. Any instance where somebody got tested, like I think our total number is around 70, but that's like everyone within 01748 that's ever gotten tested, whether they're positive or negative, symptomatic or not, a nurse at a hospital or a kid who developed a cough, like I think that's about our total number. It's about 70.
And I know you mentioned this before, but I just want to have you reiterate, because I think it's just so important to get out there. What are some of the resources in town available for anyone who would like more information on the coronavirus outbreak?
So we have the town's COVID website.
Yeah. So the IT manager, director, is part of like the emergency management team. He developed a website specific for COVID information for Hopkinton. It's www.hopkintonma.gov/COVID-19. And that has the daily press up release is on there. And then Josh, I don't know if you put it on there yet, or it's coming soon, but it's like a dashboard, because I know people are very interested in knowing the numbers, like who's positive, who's been quarantined, and all those numbers. So I think they're trying to address that online. And then I have my own website that I manage. It's www.healthyhopkinton.com. And I have COVID resources on there, posters and stuff like that to help businesses in town. And then there, of course, is the CDC website and yeah, that have like, you just want to make sure that you're getting information from a trusted source and not just like Google.
Right.
And then we're building on, developing resources for the seniors. We're looking at how to build out better resources for the college age or teens that are home in Hopkinton. So this is, a process that we're continuing to look into and address and develop. We're borrowing some from other communities, and then, we were just awarded a grant, so there may be some options to do some additional or develop some other communication networks.
And could you give us any update on the cases that are currently in town on how the people are doing? Could you talk any about that?
Typically, you can't share that type of information because it's like personal protected information.
Right.
We had 7. One is recovered. So that what does recovered mean? Recovered means that they have been asymptomatic, so no symptoms at all for over 3 days. That they are considered not to be contagious anymore. So they're allowed to be like released out of quarantine. And then our other cases, we've been lucky that everyone seems to be doing fine and they're mild. I can say that they're very mild.
Excellent. Well, that's certainly good news. Do you have any sense of how prevalent this might be in the Metro West area? Quarter of us, half of us?
No, I don't think we can say that.
Yeah.
I don't think we can speculate that,
Yeah.
because it's so hard to even be able to guess. The only thing that we know is that we can make that number smaller by not going outside and playing with our friends or meeting up. Or, that's the only thing is that we know really.
And right now, we don't have the testing capacity. That's one of the goals is as we start improving and increasing our testing capacity, we'll be able to start testing more people and get a better idea. But right now, we're tested less than 1% of the, not even a percent of the population in Hopkinton.
Yeah.
I think
and then technically the test right now, like the test is only FDA approved to test symptomatic individuals. So if you didn't have any symptoms, you can just say, give me the test, because it would probably come out. It could come out as a false positive. The test isn't designed to work that way. So you have symptoms, and then there's like tiers for how you would give out that test. So somebody that has the same symptoms but is having trouble breathing would obviously get a test before somebody who just has a dry cough.
All right. And also, I understand that you have some people observation. We have somebody asking that, do you check on those people under observation to see if their symptoms have furthered or if they're getting better or maybe just had a cold? And do you check on those people that are under observation?
Yeah, I think that those people are probably tired of hearing my voice. Because I call them, and because sometimes I can't get to people until 8, 9 o'clock at night, and I'm just following through. We maybe had a text message in the morning, but I just want to actually hear that they sound better, they feel better, So I check in with everyone mostly on a daily basis. If someone was in quarantine and asymptomatic, and there was really like little to no risk at all, we are checking in on them also, but maybe just not as frequently as someone who is like a confirmed case or has known contact or was to travel. Because we are asking people to cooperate with us, and if there was even an inkling that they should quarantine, even if it's stricter than CDC guidelines, we want to make sure that, we're following through with that and that we're working together to make sure that the community is safe.
And you two have been great at reaching out to the public with a whole lot of information, but we have somebody asking, is there any certain office hours that you could be contacted if they have any questions, and is there any programs over the internet?
Not, I mean, we have the health department's open.
Right. We're just not physically in it. But you can always reach us by email, and then you can if you call our office, those messages get prioritized and then sent to us. We get every message that comes in, and then we follow up on every message. And what we're trying to do is we're looking at developing a resource where you could go through and seeing if either the CDC or the Department of Public Health can address a question. And if you get down to the bottom and your question isn't answered, submit a question directly to us.
Yeah, this week we did. I have like a Facebook page that I have dedicated to just my work as a public health nurse, and so this week we did a Q&A. I know it's like, for me, it's hard. I get done my work day, and then I have all these questions on Facebook, and I want to get to them all, but I also want to see my kids just for a little bit. So this week we did a Q&A, which really helped me. I think just not feel like I need to hurry up and go answer those questions, because those people have been waiting 13, 14, 17 hours, whatever the timer's on in Facebook, letting me know that I haven't answered anybody. But we did that this week, and I think next week we'll try to do something similar, either do like a Facebook Live or do like another Q&A, just to make sure that people, instead of just being directed to like, oh, go look at the CDC website, but they can get like a real answer from a real person, kind of a thing.
And
One of the key things is, for us to spend this time with people. I think one of the most important things to get out to the public is that a lot of this is under your control.
Yeah.
If you're simply practicing good hygiene and minimizing your exposure, you're going to be okay. And that's what taking this extra time to speak to people or address questions that the public has is critical, because we're able to just help people understand that this is in their control, and they don't have to get all worked up and you don't need their blood pressure going up, and
you don't need to be nervous.
Don't do that.
It's
Still hospital right now
yeah, it's
that you want to go into.
and it's we do it with our friends and family, and
Yeah.
it's just but it's just the common sense actions that you can take to protect yourself.
Yeah. You just have to, there's so many things changing right now. School, work, life is what the normal life is right now. It's going to be life in 2 weeks from now. So just being able to carve out what you can control. You can control how often you wash your hands. You can control if your kids wash their hands. You can control like covering your cough. You can control how many times you have to go to the store and potentially expose yourself by getting all the groceries you need, not just getting ice cream. Like getting a 2-week supply, not just going for one thing. Like you need to avoid unnecessary trips if possible, and just controlling what you can. That will make people feel much more comfortable.
And we have a couple more submitted questions, and I think this goes along with your last point, Kasey. This pandemic is unique in its early days. At this point, do you see any ways this may change our way of life, or will it be like the flu, where we are aware of it, maybe get a vaccine and go back to the way we used to live?
I hope that everyone else has had the same revelations that I have, that I touch my face way too much on a daily basis, which is why I'm holding my hands together, because I have to do it so I don't touch my hair or my face, just because I don't know if I try my best. I don't know if I'm as vigilant about cleaning and washing my hands and not touching my face and not doing all these things in my regular life. I want to go back to being able to like go to the beach and stuff with friends. But I mean, if I go back washing my hands a little bit extra, that's okay. I think that for a period of time, it's going to be similar to like other like big trauma, tragic events like 9/11. When I was 9/11, like when I was in middle school. Like, you know, it was really weird the first time you flew after 9/11. And I'm sure a lot of people felt like that. Like, you know, is this going to be like that or is it not? And so, like, you know, the first couple times we go out and we're allowed to socialize again, and the first time our kid coughs out after they told us that coronavirus is not important anymore, like, we'll all be like, oh no, it's a kid. Like, you know, so I think it will get better, but I think it will be weird. Like, I don't think we're all gonna escape this without a little PTSD.
Oh, I have to agree. Another question submitted, is construction slowing down or stopped around town?
It's,
Okay, closer.
it is, it's slowing down a bit. They are, because they themselves have realized that they need to adapt to social distancing, and so there's been modifications. There's certain work that if it's like septic system repair, well repairs, anything that has to do with public safety is still going on. But, you know, if you need to redo your kitchen or your bedroom closet, that stuff, you know, some of the closet manufacturers are evaluating whether or not they want to be putting their staff in an unknown, you know, home or an uncontrolled environment. So that stuff we're seeing that taper off. The work that's being done outside, they're trying to, that smaller teams, but then they're realizing that, you know, if they've got to lift equipment or, you know, plywood and stuff, they're trying to figure out this as they're going. I don't think we're experiencing the kind of issues that Boston is, but we are seeing a slowdown.
And also another submitted question, is there a ban on Title V inspections for home sales?
No, but then is the realtor? Are they doing the, like, are you letting people into your home that you don't have control over? So these are the things that, do you want, you know, they can do the Title V and it's done outside, and we've made modifications as to how we're making some of the data that they need from us available. But, you know, the question is, I was about to embark on a home renovation, and you know, are the guys that I'm going to have in my house, are they washing their hands? Are they staying home? And it's, right now I put all of the stuff that I was looking at on hold. And even with, you know, at my signing, I had a discussion with the attorney before he showed up. You know, we went through, was anybody in his house or his office sick? He'd been traveling. He was asking the same questions of me. When we realized that we posed a manageable risk, we sat across the table from each other. My wife was in another area. We signed our papers 6 feet apart. I mean, but that's kind of the normal. And he was grateful for that.
Yeah.
But you know, so it gets to, if you've got to sell your home because it's critical because you've been relocated, yeah, I mean, we'll do that and we'll support that work. But if it's something kind of trivial,
for your family's health, you really should just wait
right.
till this is over. Is the best answer. I mean, like, we could try to go by case-to-case scenario, but the best decision is not to have anyone else in your house and sharing the same space that you and just your immediate family would be sharing. It's the best advice right now.
And before we sign off, and you've got a lot of great information out there today, but is there anything else that you want to get out there to the town of Hopkinton?
Yeah, I guess I guess, I just want people to understand that, that we are working really hard. There's four of us in the whole department, but when it comes to like the public health part, it's really just me and Shaun working on stuff, and with like the assistance of the school nurses and stuff. So I do appreciate people's support and their ideas. I want people to know that coronavirus can be very serious. Like they're describing, it can be shortness of breath and fever and a cough, or it can be very mild. It can just be like a cold or just a fever that's not even a fever. It's just an elevated body temp of 99 with maybe a cough, or 99 and a runny nose. That it's not the severity of symptoms that makes you positive. So like, if you're sicker, like you're not more positive. You could be positive in an ICU bed and positive at home. So if people should really be sticking to the guidelines of social distancing, because somebody could have what they think is just allergies, and then you'll find out in a week that it wasn't allergies, and you've let your kids play with them, or they've been over your house, and then you went to your grandmother's house to deliver a pasta dish, and now you got to figure all that out. You can just avoid all that headache by just listening to the rules for hopefully just a few more weeks.
Well, I think I could speak for all of us that work, live, or have involvement in the Hopkinton community when I say thank you for all you both do, and the many hours, days, and weeks of hard work that you both have spent on this, and your communication with the town about what is going on has been sensational. So thank you so much for all that you have done during this coronavirus pandemic.
Yeah, thank you so much.
Yeah, thank you guys.
Yep.
All right, well, thank you for joining us, and we'll certainly have you back on at some point, I'm sure. And you too. Thank you very much, Shaun and Kasey.
Take care. Bye-bye.
All right, that was Public Health Director Shaun McAuliffe and Public Health Nurse Kasey Mauro. And of course, you could go to the town website for all kinds of coronavirus information in town. And you could also go to our website, hcam.tv. We have a lot of resources on our website as well, but a lot of great information provided by Shaun and Kasey. So we're certainly grateful that they came on the show today. And we will be doing this show every weekday, Monday through Friday. So there is another one tomorrow at 2 p.m., 2 to 3 every weekday. We will be doing the Hopkinton Hangout Hour. We'll be live on hcam.tv as well as our YouTube page. So for everybody here at HCAM, a big thank you to Matt Clark for assisting with the social media. Matt, I think there was some great information out there today. All right, well, Matt was muted, but that's just about going to do it. We will catch you tomorrow with the Hopkinton Hangout Hour at 2 p.m. We're going to have many great guests on, and we'll be talking about many various topics. And if you want to participate in the show, find out more details at our website, hcam.tv. Perhaps you could even co-host the show. Perhaps you could be a guest on the show. We'd love to have you. But this is our way of staying close with the Hopkinton community and keeping you in touch to what is going on. So for everybody here at HCAM, I'm Tom Nappy, and thank you for joining us. Enjoy the rest of your day, and we'll talk to you again soon.
Goodbye.